Okay. This presentation focuses on individuals experiencing homelessness or housing insecurity. Understanding homelessness and housing insecurity. This group includes people living in shelters, on the streets, in vehicles, or temporarily with others. Common causes include poverty, mental illness, substance use, and domestic violence. These individuals face major health challenges and often lack consistent care and access. Nurses play a key role in addressing both health issues and connecting patients with needed resources. Unique characteristics and healthcare needs. People who are homeless or housing insecure often face multiple chronic conditions like diabetes, COPD, or hypertension, with many struggling with mental health or substance use. Their living situations put them at risk for injury, infections, poor nutrition, and worsening disease. Many avoid care due to lack of insurance, transportation, or previous negative experiences. Culturally, many value independence and may distrust healthcare systems. As nurses, we must provide respectful, trauma informed care that builds trust. Homeless individuals face major healthcare disparities. They often lack access to basic services and struggle to manage chronic or mental health conditions. Common barriers include no insurance, no transportation, or lacking identification. Many also face stigma and discrimination when seeking care. Because of unstable living conditions, it's often hard to follow through with medications or appointments. This leads to frequent emergency department visits and poor outcomes. In my role as an emergency department nurse, I often care for patients who are homeless and highly guarded. Many value independence and have negative experiences with healthcare in the past. To address mistrust and stigma, I focus on trauma-informed communication and respect personal space. Because many patients can't follow traditional discharge plans, I try to tailor care to what's realistic, like providing wound supplies. Practical strategies help to address real barriers. In the emergency department, I keep hygiene kits on hand. These small items show patients we care. I avoid using labels like frequent flyer and instead focus on listening. I ask the patient, "What do you need today?" rather than just assume. Partnering with social workers is key, especially for follow up care or housing referrals. These strategies not only build trust, but directly reduce disparities in care, access, and quality. This here I made an example of a patient presenting to the emergency department. One night in the emergency department, a man in his 50s came in with a foot infection. He was clearly homeless and very guarded and refused care at first. I offered him clean socks and a sandwich and let him rest while I cared for another patient. When I returned, he was calmer. I avoided pushing him and instead asked, "What do you want to take care of tonight?" That helped build trust with the patient. Eventually, he let us clean the wound, start antibiotics, and even speak with his social worker. It reminded me how small, respectful actions can lead to big changes. I also provided here resources to deepen cultural competence and homeless care. For nurses looking to deepen their skills, there are many excellent resources. This includes the National Healthcare for Homeless Council that offers evidence-based training tailored to this population. Substance Abuse and Mental Health Services Administration is also a great resource for trauma-informed care guidance, and the CDC has health equity tools to address these disparities. The American Nurse Association also provides continuing education and cultural competence. I also highly encourage looking into local shelters or outreach teams to learn about specific needs in one's area. Last page here are just our references, and that completes my PowerPoint.